In the past few weeks, I've spoken to 5 people from my rural constituency of North Devon who have been forced to remove their own teeth with pliers or with amateur surgical kits bought online because they are unable to find an NHS dentist.
It's absolutely shocking.
2 years ago, I raised the case of a Norwich Army veteran. In such agony, he was forced to pull out 18 of his own teeth because he couldn't get access to a dentist.
Nearly 14 million adults are unable to access NHS dentistry in England. 14 million? Just think about that. It's well over 1 in 4 of England's adult population.
People are being forced to pull out their own teeth at home because they can't get access or afford an NHS dentist.
For millions across England, NHS dentistry has effectively ceased to exist.
They started arriving long before the doors of this suburban dental practice had even opened. By the time they did, hundreds of people of all ages were willing to wait for as long as it took to sign on as an NHS patient.
This country now spends the smallest share of its health budget on dentistry of any European nation.
It's not the first time the opening of NHS lists has sparked a stampede to dentists' doors. These scenes in St Paul's in Bristol drew concerns from the top of government.
This is what then Shadow Health Secretary Wes Streeting said in February 2024.
Unless you reform the NHS dentistry contract and make NHS dentistry pay for dentistry, we're going to see more and more queues like this across the country.
The Labour Party went into the 2024 general election promising to reform the now discredited NHS contract, which it accepted was fueling the current crisis. A year in government, and now Health Secretary Mr Streeting says this.
I'm hesitant to kind of make specific promises about dates and deadlines because unless I'm 100% certain I can achieve the promise, I don't make it, because if there's one thing in even shorter supply than dentists and money in our country at the moment, it's trust in politicians.
The dental contract was recently highlighted by the Public Accounts Committee as one of the main reasons for the NHS dentistry access crisis. As to the timing of the reform of the contract, in evidence to the Health and Social Care Committee, the Minister for Care, Stephen Kinnock, said this.
We are absolutely clear that we have to fix this before the end of this Parliament.
Well, that could be years. People are being forced to pull out their own teeth with pliers right now. The current situation isn't even Victorian, it's medieval. And every day the now discredited NHS contract remains in force, more dentists walk away. And if that's not bad enough, the Care Minister has warned we should assume there would be no increase in the service's budget, which has been cut by over 1/3 in real terms since 2010.
We have to work on the assumption that we will have a financial envelope that is in the region of the current financial envelope. That is the reality.
With nearly 14 million adults unable to access NHS dentistry in England, that's not exactly encouraging.
We have to cut our cloth based on the resources that we have.
Meanwhile, the state of NHS dentistry grows ever more desperate.
The dental crisis has turned a dark corner.
Their website was quite a believable website.
With NHS appointments getting harder and harder to find, unscrupulous scammers are targeting people desperate for treatment.
Criminals are now seeing an opportunity, targeting millions of desperate people with no options.
I've spoken to patients on a regular basis, some of whom have taken their own teeth out, and I know how desperate people are. And this is really, really worrying that people are taking advantage of that desperation.
Current funding is only enough for half the population to get an NHS dentist. Just think about that. And tooth decay, which is almost entirely preventable, is now the #1 reason for hospital admissions among young children.
The British Dental Association has told this programme that current waiting lists to see an NHS dentist are the worst they've ever seen across the whole of the UK.
It's absolutely shocking. That's why I'm joining the British Dental Association in calling on the Prime Minister and Health Secretary to properly fund NHS dentistry now, so everyone can access the crucial dental care they need. If you're one of the 14 million adults unable to access NHS dentistry in England, you can support this call for action by signing the petition linked to this film. It only takes a moment. For a generation, political choices made at the Treasury and the Department of Health have left millions desperate and with no options. Let's send a message together that enough is enough.